Let's have a conversation within the dental or the dentistry space. We have in studio Dr. Pamela Aban Ohenijan.
Hello.
How are you, Doc?
Thank you, that's fine. Dr. Pamela.
She is a conference convener for the inaugural Ghana International Dental Scientific Conference. And we also have Professor Sandra Hewlett. Good.
Hello.
She's the Dean, University of Ghana Dental School. And we have Dr. Adimuli.
Adejumoke.
Adechimoke.
Yes.
Good. Adiyemi. Good.
Adeyemi,
She
yes.
is a senior lecturer of the periodontology. Why do people have long names like that? University of Liverpool School of Dentistry. So we're going to have a conversation on the Ghana Dental Scientific Conference, which is happening soon. They will tell us details of this particular event that we will be telling you about shortly. Once again, you're all welcome, Doctor.
Thank you.
And we're going to have a conversation. But first of all, when it comes to dental health, let me start with you, Dr. Pamela. What will you say about dental health when it comes to a particular human being and how important you should carry yourself when it comes to dental hygiene?
Right. Thank you, Philip, and thank you for having us today. So, dental health, dental hygiene is extremely important. It's important because we as humans, it's a gateway to the body.
Okay.
If we don't keep clean, we have bacteria, we have bugs. We always have bugs in our mouths anyway. But if we don't keep things clean, then there's a different balance of the bacteria in the mouth, and then it starts causing problems. Apart from dental disease, it can also lead to other diseases. So you can have kidney issues, you can have heart issues, cardiovascular issues, and it can lead to diabetes, etc. So these are all things that make it very important. So we advise clean your teeth twice a day. Keep cleaning in between your teeth. Prevent these diseases by reducing the amount of sugar that you have, and in fact, snacking in between meals, etc. So these are very important key messages that we want to send to the public.
So do you tend to get people maybe at your facility or come across people who are having problem with their teeth or say in their buccal cavity and they are not able, it's not able to be dealt with?
Well, it ranges, doesn't it? You have from as little as bleeding gums all the way to dental abscess that is blown out of proportion, where you have to then manage it almost like an emergency situation, and then all the way to losing teeth, an unfortunate situation where you lose your teeth. So yes, there's some people who would come in. We do the best we can, but sometimes even the best is not enough.
Wow.
And we have to then say, look, you've got to have your tooth taken out. And we don't like to do that. Gone are the days where dentists were known to be just pull teeth out people, or doctors who pull teeth out. That's very different now. So as much as possible, we'll try and save teeth.
I actually didn't know it can lead to kidney disease, diabetes and all that. But Dr. Adeyemi, finding out from you, ideally, how many times should an individual be at a health facility to check what is happening in his or her mouth?
So it varies from person to person in terms of what your risks are. But what I will suggest is that for everyone, at the starting point, attending to see a dentist who will do a thorough examination in addition to asking questions, and they'll determine what your risk is. So for some people, they have a low risk for certain diseases like tooth decay, gum disease, etc. And they might be seen once a year. For others, they might have what we call a moderate risk, and that might be every 6 months. Whereas for others that have gum disease, we need to see them every 3 months. So the dentist is trained to take on board all of those bits of information, determine what your risk is, and then they would advise you as is appropriate. But what I would say is that at least once a year, you need to see a dentist just to be sure that your oral health is
It's okay.
Yeah.
Normally, what people say that if your teeth doesn't look white, that means you have a problem. Can people who may have white teeth also have a problem with their teeth?
Definitely. So the color of your teeth is determined by so many things, right? There are situations where you have malformations as people develop due to developmental defects. That's a separate thing. But for the average person, a lot of the shade of how our teeth look, etc., it's just purely aesthetic, right? Provided you have healthy enamel, which is the white bits we can see, there will be a variation. So if someone is dark, for instance, your teeth might appear whiter than someone that is light. And that's because of the color contrast when you've got light shining on teeth, etc. So what is more important is that you are taking preventative measures to look after your teeth. You're brushing regularly, twice a day, at least for 2 minutes. It might be for longer if you have gum disease. You are, like Pamela said, controlling your sugar intake, limiting it as close as possible to meal times, right? And generally just looking after your whole health, exercising regularly, eating good food in terms of less refined processed foods, eating more holistic, wholesome grains, for instance. That all has an impact, because remember, the mouth is the gateway to the body.
Exactly. Yeah. And I know that a lot of factors you need to put in place will affect your teeth or what happens in your mouth. But with you, Professor Sandra, the issue of dental, or when it comes to whatever is happening in your mouth, Professor or Dr. Adeyemi made mention of brushing your teeth or adhering to some measures. Are there specific ways to go about to say you are brushing your teeth twice a day, but it may not be the proper way? Is there any instance like that?
Yes, so when you walk to your dentist, they'll actually teach you exactly how to do it and do it right. Even the items that we use. Ghanaians tend to like very hard brushes, but that's not the best.
Because without the hard, you need to face so that you remove everything from your mouth.
But that is wrong. You'll be doing a lot of damage to your gums and to your teeth. So the best thing to do would be to go for a soft to a medium brush. And then we tend to like the scrubbing action where it feels like you're using a scrubbing brush.
Yeah, you can
hear it. Yeah, I know, but that's not too good for you. So when you walk into a clinic, we'll actually teach you how to do it and do it the right way, and then the techniques to do it, so that we are ensuring that you're getting good health. And also to add, we tend to want to wait till there's pain somewhere, something hurts before we go. But most of our dental diseases can sometimes be very silent, or not painful in the initial stages. So a hole starts, you feel like you're eating food packs into the tooth, and you feel like it's okay. But at that stage, that's the best time to seek treatment, when it's painless and it's less complex and it's easy to restore. So don't wait for the pain to start. So like she's saying, at least once every year, let's visit, let's be sure that we
know of this traditional way of keeping your teeth clean, or handling it, which the sponge.
Yes.
People are saying that now we are using the toothbrush. As a dentist, the old way of keeping our teeth clean and also solving stuff in our buccal cavity, was it appropriate, or what we have now is the best?
So I think the old way also had its good ways and effects, because looking at studies comparing our caries rates, or that's having a hole in your tooth, relative to other areas, our caries rates were very low, and some attributed it to both the chewing sponge, the chewing stick. The only problem is most of the time you wake up in the morning, you put the sponge in your mouth, and for 30 minutes it's just chewing. You're not really cleaning. So it's more about the technique of how it's done. Even the chewing stick, the good thing is it also helps clean in between the teeth, which was also effective. The only thing is, now we don't say, if you can't afford a brush, we don't say just don't use the other traditional methods. Just add a fluoride containing toothbrush and do it effectively. Don't just chew and then throw it away. But as you're chewing, you're cleaning. So it's just about teaching you how to effectively use them, so that you achieve the good results for them.
Wow, beautiful. Dr. Pamela, some people may have dealt with halitosis for a very long time, but they don't seem to have a solution to the problem. First of all, I want to find out for you, what are some of the cause agents, or what causes halitosis in the first place?
Right, thank you. So halitosis is bad breath, and it's multifactorial, halitosis. So it could be from the fact that you're not, as simple as you're not cleaning your tongue. When you brush your teeth, clean your mouth, brush your tongue. It could be as simple as that. It could be that you're harboring plaque, so you're brushing your teeth, but you're not cleaning everything off. You're not cleaning in between your teeth. It could be you've got, the plaque has hardened and formed tartar, which we call calculus. And that's stuck on the teeth, and it's harboring, again, bacteria. It's the bacteria that give off the scent. So general good oral hygiene and professional cleaning usually helps. And there are mouthwashes as well that can help manage.
Oh, interesting. Let's now talk about the conference, which is happening soon. What is the essence of this conference we are looking at here coming up?
So with the conference, with the theme, it's about the current trends in dental science. And really, what we've come together to do is to sort of bridge that gap between the basic science, the research that takes place, but also seeing how that translates into good practice. So you probably would have heard the term evidence-based dentistry, where you're looking at the best practices that help you get better outcomes for your patients. So what we're wanting to do is, I'm privileged to have been invited to speak at that conference, is to share our knowledge base. Pamela probably, she's a visionary behind it, so she'll probably be able to expand a bit more. But I think in a nutshell, what we're wanting to do is knowledge exchange, you know, sharing what's best practice, what's the evidence behind what we're saying and what we're doing it, so that it benefits our patients in terms of the best treatments possible, and also enabling a better quality of life for our patients.
Beautiful. So with this conference that is happening with you, Prof. Sandra, how many dentists are you looking at bringing? Is the conference only meant for dentists?
No. So we have dentists, we have our auxiliary staff, we have dental nurses, dental technicians. They're also going to join us. And we also have our students. It's also good to catch them young.
Oh, yeah.
So some of the dental students too are also going to be a part of it. So it's just not just for dentists.
Wow. Dr. Pamela, from what Dr. Ademi was saying, that you are the best person who can share with us details of this conference. What are you looking at achieving at the end of the entire conference that we are looking at having?
Right, thank you. Actually, I think Dr. Jumoke summed it up very well, actually. So like what she said, we want people, the dentists and auxiliary staff, to come in, understand what is happening around the world. It's international. So we have speakers coming from the UK, Dr. Jumoke is one. Professor Farida Fortune from the UK, she's our keynote speaker. We have some doctors coming from Egypt as well. And we have our local Professor Nyaku, who's also who was the recent past dean of University of Ghana. So we're bringing all these great minds together, and we're saying, come and learn, come and upgrade, come and improve your hand skills, because that is, I think that's the key area of this conference. And people are really looking forward to that. That come in, you may have done it as a dental student, you may be working on patients, but we're saying, even though you've done all that, come and see how maybe is the new equipment, cutting edge equipment, etc., being done, and then also come and learn some new skills. And we're doing this in association with the University of Ghana Dental School. We've got the Ghana College of Physicians and Surgeons were really supporting us. Medical and Dental Council, our regulators are also in association with this, and the Ghana Dental Association. So we've got all these, the main bodies of dentistry in Ghana coming together.
Beautiful. So it's a 2-day event.
It's over 2 days.
28th and 29th.
And 29th.
On 28th, what exactly will be the activity for the day?
So 28th, which is at the Ghana College of Physicians and Surgeons in Ridge, that is lectures. So we have 5 lectures. We have policymakers going to be there as well. Hopefully we get the Minister of Health to be there as well. And there's going to be as well panel discussions. So people question and answers, people who have cases that they think, oh, we've got the experts, something is beating my mind, I want to ask this question, I might get some ideas from the panel. So that's the first day. And then the day 2 is in University of Ghana Dental School, and that is the hands-on practical sessions. We have about 7 hands-on sessions, all different disciplines. Periodontology, we've got oral surgery, oral maxillofacial surgery, we've got sedation, so that's for people who are anxious.
Okay.
People who come to the dentist and are so anxious, how to handle them by giving them sedation, because we know some of us are anxious and nervous when we go to the dentist.
When you go to the dentist.
Yeah. And then we have the ever so popular composite bonding.
Okay.
You know, when you go to Instagram, Facebook, there's all these composite bondings.
Yeah.
So we're saying, come and learn it, come and learn how to do it.
Wow.
To a very high standard. But we call it composite veneers, the technical term.
So
but yeah,
a lot of information and learning will go on at that particular event. But Dr. Adeyemi, you made mention of the fact that you'll be lecturing there.
Yes.
Can you share with us some of the few things you'll be sharing with fellow dentists and also students?
I think for me, periodontology is the study of gum diseases, right? And it's prevalent all over the world. Well, Africans in particular, we have a predisposition to developing this condition. But it's not just a condition that affects just the mouth. It has impact on our systemic health. So there are links between this disease and diabetes, chronic kidney disease, hypertension, cardiovascular disease, which are common diseases that affect us in this part of the world.
Okay.
So for me, it's about sort of bringing out the research, talking about the need to have a preventative strategy to manage. We've all heard about prevention being better than cure, because if you look after your mouth, you're actually looking after your holistic health. So that's the prime message I'm going to be pushing. But also talking about techniques that we can utilize to manage patients that might unfortunately be suffering from this condition, and hopefully enabling my colleagues here to better manage those patients.
We really need it. Final words from you, Professor Sandra, then we can wrap up.
Thank you very much. I think this is an awesome collaboration. Great knowledge, great minds from all kinds of places. So I think it's a great opportunity to come. So if you're a dentist, you haven't registered yet, it's not too late. You have till today, till tonight to register. Register and join us.
Beautiful.
Thank you.
Thank you so much. Any contact you want to share if someone has to register, but we can see it and on the flyer. I will share with you shortly. Okay, on the flyer that we have it on the flyer 0550-92971. Good. So if you want to register, please make sure that you are part of this event and register now if you want to help the space and ensure that at least we help people get better, say, part of their mouth.
Yes.
If not all. So thank you so much, Dr. Pamela. Thank you so much, Professor Sandra and Dr. Adeyemi. Thank you so much.
Thank you for having us.
Thank you.
This was the conversation on the Ghana Dental Scientific Conference, which is happening on the 28th and 29th of May. So you should be part of this event so that we would all know how to best solve the problems we have in our mouth. Just